This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're in the Aurora Pharmacy and we're going to be talking about something you may or may not have heard about. They're called essential oils. Now we're going to be sitting down with Dani Dins. She's a technician here in the pharmacy and she's going to be telling us about the many uses and benefits of using these oils. Well, thank you for joining us today. This is a little different and maybe new to a lot of people. Essential oils. Just give us a little bit of a background of what an essential oil is.
All right. An essential oil is actually a derivative of either a plant, a root, a bark, or a flower on plants. And what happens is it is either diffused or pressed out of that plant, and it becomes a highly concentrated oil in which we can use for medicinal purposes, other therapeutic uses. It was highly used back in ancient Egyptian times, and Greek and Roman physicians used them for years. It was passed on down through several centuries up until about beginning of the 20th century when modern pharmaceuticals came and we were then kind of drifted more into the synthetic drugs.
Sure, and you can find these at the pharmacy at Aurora in Oshkosh and Fond du Lac. And I want to talk a little bit, you might notice this thing, it's smoking. It's not smoking, it's a diffuser. Tell us, you mentioned, you referenced it, how to use it, or one of the uses, it's a diffuser.
Yes, it is. So there are two main uses for the essential oils. Topical use, which would be applying it to the skin, and then diffusing it in a diffuser. So what happens is you put the oil into the diffuser and then you can see it's on a pulse setting right now, so it will diffuse the cool mist into the air. So how that works is by the ultrasonic waves. It breaks up the particles, sends them into the air, and then we can enjoy the therapeutic benefits for several hours throughout the day. And the topical use would be used where you have an inflammation in your knee or your ankle. You could apply that topically and help that inflammation.
Yeah, those are just a couple of the ways
Yes.
or symptoms that you can use to use the oils. Tell us some of the more common symptoms that a person might use essential oils for.
In the pharmacy, we see several. Some of the most common would be a scenario where maybe a patient's insurance wouldn't cover their sleeping medication anymore, either due to their age or just wanting them to try other things first. So at that point, they'd come into the pharmacy, we'd have a discussion with them, and we'd probably recommend like a lavender oil for them to use at night to help them sleep. Very common things also with inflammation. We would recommend that versus your over-the-counter Motrin or Tylenol as that anti-inflammatory.
All right, so you mentioned a couple of oils for a couple of symptoms. How many oils are there?
Over 80, I believe. Probably close to 100. Between 80 and 100, I would say, single oils. But then the fun thing to do with them is to mix them into your own blends and make your own creations. So really countless.
I won't ask you to name all of them.
We'd be here a while.
Yeah. Now you also have is this a bar of soap?
It is. People will do many different things with the oils as we discussed. So there's the medicinal type things. Also people that want to perhaps have a clean house from cleaning chemicals. So they'll make their own soaps, or they'll make their own laundry detergent or cleaning supplies if they want to get the chemicals purged from their homes. So like I said, possibilities are really endless. Pinterest is your friend. Several books are out there, great books are out there that you can find recipes for any ailments, any home uses, so on and so forth.
Yeah, and I would imagine, you mentioned the different combinations for this too. You're very knowledgeable on this, and I believe you give some seminars too?
Yes. I've done a couple of lunch and learns within Aurora over the years, and I could talk for hours. We'll keep it brief today. But yes, it really is countless. It's a lot of fun, a lot of, new, more holistic type medicine that's working hand in hand with the traditional medicine. So it's nice to see the two kind of coming together.
Yeah, do you see more and more physicians kind of buying into the essential oils?
Yes, we do have a handful of physicians here in Fond du Lac that will come down and pick out the oils for their patients. It's becoming a little bit more, joining that mainstream again, but hopefully there'll be more.
Yeah, and I know somebody very well that uses it at home. It's not always just medicinal. It's also kind of a stress, or as you mentioned, kind of help you to sleep. And I noticed the light here. Perfect in the evening.
Yes, it's good that this is actually my son's nightlight that I stole from his room to bring today. But yes, as you said, stress is a great one. Another great use for the diffusers is if you have somebody that's at home that's been sick, a cold bug going through the house, you can run an antiseptic or an antibacterial oil through your diffuser, help kill any of those germs that might still be lingering in your home. So, and hopefully knock it out before it gets to everybody in the house.
It's been my experience that people that know about essential oils, I mean, they really get into it. Now, I'm sure we have a lot of new people being introduced to essential oils. What's the best way to really kind of learn more about this?
What I would say, if you want to learn more, give us a call at the pharmacy. We'd be happy to talk you through anything. I would say anybody that's out there just looking to kind of get started and dabble, pick up just a couple that have a really broad spectrum of ranges. So a lavender, a peppermint, a eucalyptus, those would be great starting oils that literally have probably 40 to 50 uses for each oil that you could, it's a very minimal investment and get started and have some fun.
Are there people that shouldn't use the oil, or even pets? Is that an issue?
Yes, there is a handful of things. Relatively speaking, if you're using them correctly, they are very, very safe, means of therapy or just fun. However, pets I would definitely consult your vet to make sure what you should be having diffused in your home or using anything topical on your pet. Other people that would use caution would be anybody with high blood pressure, any heart issues, if you're pregnant or thinking of maybe becoming pregnant in the future, and anybody that's currently battling cancer should check with their doctors, find out if there are a list of oils that they should steer clear of, at least for certain windows of time.
And I guess we should ask, are there any side effects to using essential oils?
Like I said, they are very limited if you're using correctly. Using on any children or elderly people, I would definitely dilute them to half strength, just because they are known to be a little bit more sensitive to the concentrated oils.
Okay. Well, we appreciate you taking some time with us today.
Thanks for having me.
I have the lavender and it smells wonderful. Now, you can find these essential oils at the Aurora pharmacies in Oshkosh and Fond du Lac. If you have more questions about the oils, you can always give us a call at 303-8700, and our good folks in the pharmacy will be happy to help you. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.